Welcome to First Star Let's Chat, an athletic therapy podcast. I'm your host, James Gardner, certified athletic therapist, certified strength and conditioning specialist, yoga instructor, human being. This platform, for the pros, by the pros, anybody in the performance space, and beyond. Welcome here to share in the stories of professionals, experiences, journeys, learning along the way. It's a platform to connect, to network, and to be a part of a community that cares, with conversations that matter, experiences that resonate, and generate ideas, thought-provoking, organic dialogue, passionate pros. Brought to you as always by First Star Therapy, Mobility Tape, Epic, and Benchmark Athletics. In association with the Canadian Athletic Therapists Association. It's First Star Let's Chat, an athletic therapy podcast. Thanks for being here. Thank you for being a part of it. Welcome to First Star Let's Chat, an athletic therapy roundtable brought to you by First Star Therapy. I'm your host, James Gardner, and this is a platform for the pros, by the pros. Passionate pros, organic dialogue. Let's chat. Thanks for listening. Let's roll. So here we go. Let's jump in. Thanks for being here, everybody. Really appreciate your time as always. A few of you are returning. Most of you are to more than one session, so this is awesome. That provides a little bit of feedback for me as well. And again, if there's anything that we missed or you want to go back to, just feel free to reach out at the end. But tonight's guest is Dr. Luciano Di Nardo. He is a physician of over 25 years experience and a deep interest in athletics and the collaborative approach to sports medicine. Dr. Di Nardo holds an additional diploma of Occupational Health Services from McMaster University and is registered with the Canadian College of Family Physicians in good standing, graduating from the University of Toronto as a medical doctor. He currently practices in a primary care facility and provides occupational health services to multiple industries and is an active staff member at Humber River Regional Hospital. So that's the formal introduction of Dr. Di Nardo, and I'll let him get into some of the things that he does as we go through this and as he says hello. But Dr. Di Nardo and I met each other actually through a rehab scenario for one of his daughters, and then that continued on to a second daughter, and we stayed in touch ever since. And, a lot of really good discussions in terms of this topic tonight, working in the amateur space and looking at the opportunity for athletic therapy to really continue to make inroads as a profession, but also within that space where we can have a lot of power. So a lot of common threads to some of the stuff we talked about. But Dr. Di Nardo, Doc, if you want to just say hello to everybody, that'd be great. You can jump in.
All right. Thank you so much for that great introduction, James, and pleasure to be here. Thank you for the opportunity to kind of share in your little project here. Great to be part of it. So you let me know where you want me to go, or some areas, or just I can speak a little bit of my history and what I've done and what my regular day is, and then we can take it from there.
Yeah, so why don't we start there? Why don't we just start with, I know you work with different professions in terms of screening and clearance and all that, whether it's in COVID-19 or prior. Will you just give us a rundown of what a general week looks like for you in the medical world, and then we'll jump into some topics and discussion from there.
Sure. So I run a practice, primary care practice, and I do a lot of occupational health. So standard family practice, Monday to Friday, and that has its own challenges. And so mainly middle-aged to geriatric population there, not a lot of young athletes there. And that would be my regular kind of day job. But then on part of that day job is also occupational health. So that occupational health I've been doing since 2012, about 1998 actually. And so my major industries that I service. One is the pharmaceutical industry. So I service a large company, about 5,000 employees, where we basically make sure they're certified and they're good to go to work, pre-employment kind of examinations. And then I also do a lot of work for first responders, so EMS, paramedics, police services, and also for firefighters. And there we're dealing on multiple levels: pre-employment screening, baseline testing, and also health and wellness programs where we see them on a regular basis and check for certain things in terms of prevention. That's an area within that first responder group, especially within the firefighters, of the kind of industrial athlete. It's kind of a new terminology that's used now. So they've taken a whole new perspective on how to deal with their health and wellness. So it's not, there's a lot of health and fitness when these first responders get to work and they have a certain criteria they have to meet. But then going forward, you would look back in the 1970s and you say, the average fire hall, what was their diet like? What were their BMIs, and what was the number one cause of death? And that was usually cardiovascular. You go from the sedentary job to all of a sudden going to 100 miles an hour, and they were having issues with sudden cardiac death. So there's a whole new philosophy there trying to bridge that and trying to promote health and wellness early on. That could be from a dietary standpoint of view to physical fitness and to screening. So that's where we come in, especially in the screening point. So that's what I do. Recently, obviously with this COVID-19 issue, totally changed the practice. So what was a normal week is no longer a normal week. So we went from seeing our patients to basically probably one of the first in our medical clinic to kind of screening people by phone initially before they had any bans, and kind of developing our own program. So, and to going to full masks, visiting patients well before it was recommended. And so, and also developing strategies for companies in terms of what they were supposed to do with their employees. If they're exposed, not exposed, if they had the illness, when to come back to work. And we were trying to develop those strategies before they were even published. So and that was a lot and anybody who's interested in the latest and most updated source, I would urge you to look up the article that's published by Up to Date. I don't know if anybody's aware of that, but Up to Date's one word, Up to Date. And they essentially update that almost every week with all the published review articles or published scientific research on that. And that's what everybody's using to come up with all these protocols, like 14 days for asymptomatic period, or 14 days from onset of symptoms to return to work. And so all that information is out there. So yeah, so that's my regular job. And as James said, we've had a long history with lots of time to have our 5-10 minute chat after with regards to rehab and sport in general, and where things are going and where things could be better, and overall goals, and yeah, certainly we can go into that in a few minutes as well.
Yeah. No, thank you for the overview. I think it's important for all of us as athletic therapists, and I heard it through the AMM, or part of it yesterday, for the OATA. For a provincial board. Anyway, just talking about how, as athletic therapists, we really can service anybody who's active. And that population that you work with is certainly considered active enough. And so while we are going to sort of focus on amateur athletics tonight, what I'm really trying to idealize for myself and sort of put in perspective for all the younger, students and people who may be looking to do something new or change the world a little bit, is all of this opportunity that's out there, and how dynamic your practice is in terms of implementation and your ideas to sort of change things. So really appreciate the overview, and we'll dive in a little bit to the amateur stuff, and we'll talk maybe a little bit about daughter 1 and daughter 2 and surgery 1 and surgery 2 as we go, just for reference points. But again, really appreciate you taking the time. No, these days are pretty crazy for you, especially in the medical practice. So thanks so much for your time.
No, my pleasure. My pleasure.
All right, so let's just shift a little bit to start in terms of your practice. Like, you used to being in an office and having people come to you. You've obviously shifted to online. Have you felt it's been beneficial? Has it increased your workload? How have things shifted for you? Because I'd imagine the majority of your stuff is in person until this point, and now it's sort of gone the other way.
Sorry, I just broke up there a little bit, James, but relatively going online has presented its own challenges. I think there have been some great things that come out of it. I hope we learn a lot from it. A lot of it is, simple things are really good. A lot of patients are appreciative of being able to have a prescription. Are we okay? Can you guys hear me?
Yep. It's a little bit, that's fine, that's good.
Yeah. So in terms of, there are things that are very convenient and patients are very appreciative that we call them, and there's prescription renewals and simple things that are taken care of over the phone. So lifestyle, it's really great that they don't have to come in and sit for half an hour to get a simple thing resolved. But other things have been more challenging in terms of the sicker patients who really need a clinical assessment. In those situations, it's been very difficult. So, and we've gone through this, and so I've said to my colleagues and speaking to other people, healthcare professionals, allied professionals, we're almost down to now treating a single illness. So the mass media and everybody's just talking about one particular illness, and all our resources are kind of, it feels like we're all going in one direction, trying to prevent this essentially surge of illness. But on the flip side, there's a whole bunch of things that are happening undercurrent that we're not really paying attention to. So in my particular practice, I had my first patient call me probably 2 weeks into this process with diarrhea and a little bit of fever, and they thought, well, maybe it's just a gastro. Called the telehealth provincial authority, who would prescribe something. And a couple of days later, I was already getting inkling, this guy's just not doing well. High fever. And by the end of 6 days, then started with shortness of breath. And then within about 48 hours was intubated with COVID-19.
Wow.
So completely atypical presentation, and yet it's there. So that's patient number one, who comes in a atypical presentation and ends up with COVID-19. The following week, we have what's called the hospital management system, where we get all the discharge notes and medical consult notes through our electronic medical record keeping software. And so every morning I log in and I get updates on my patients. By the following weekend, we had we had one person who I was counseling over the phone during the week, was becoming quite anxious. And by the end of the week, it was suicide attempt number one. I had another patient of mine who was a hairdresser, lost his business, or perceived to be thought he'd lost his business, go into a psychosis. So that's two patients. And then the following week, my other patient, who was a end-stage cardiac kind of renal failure patient who didn't want to come in for his electrolytes on a regular basis, he was on high-dose diuretics, basically had a sudden death at home, right? So, you have two sides to what's going on, and we're not really paying attention to all this other stuff that potentially is happening, and yet, what's the collateral damage to the change in the system we're providing, right? And so, that's another thing. That was a first-time event. I basically filled out a death certificate without visiting the patient. So so that patient ended up dying at home. I found out about it. The police were called. The police called the coroner. The coroner never showed up. The coroner calls me. We have a discussion. The police don't have any concerns. And the coroner asked me to fill out this death certificate to fax to the funeral home in order to get this body removed from the home. And I'm saying, no, I haven't even examined this patient. You want me to pronounce them dead? Oh, it's okay. Under the new rules, you could do that. So that was a kind of thing that I was a little uncomfortable with, because you always have to be present. You can't do that remotely, and yet they accepted it under the new rules.
Wow.
And so that's this is just a basic family practice kind of meat and potatoes kind of things that happen, and yet under the new set of kind of parameters about distancing and protocols, these are the consequences of what happens. And so, it's something that we're not measuring in terms of, what are the consequences of these actions. So I don't think they can be long-term, because these consequences are going to build up. And so we need to balance that. At some point, you save 10, but you lose 30. What have we really done? And so we're going to have metrics to measure that.
Yeah, this is the very the stark reality of things, and I think some good lessons, although maybe not quite as severe. But there's a lot of stuff going on out there in terms of athletic therapy in the active world, of people prescribing things and doing these online workouts, and like maybe not to the end of what you're dealing with, but people at home are taking things in some cases to the nth degree, and they're doing 6 workouts a day, and they're trying to do all these things and look and feel a certain way. And as people who are advocates of wellness and of health, I think part of our role in this is similar, in that we need to keep things in check. This isn't about necessarily morphing people into the greatest CrossFit workouter people in the world at this point in time. It's about sort of coaching them through wellness and keeping them on track and on pace to stay healthy through this as best as possible. So when it comes to prescribing movement and to prescribing or doing stuff virtually with assessments, the in-person stuff is lost. You can't make up for that virtually. So these are good lessons for us as well. So finding ways to stay within the scope of practice and not overreach, I think that's huge.
Yeah, I think for sure. And the other commonality to everyone is knowledge. And so knowing, I think there are huge knowledge gaps. The stuff that we're, in the mass media versus the science on which all these things are based. I think a lot of the authorities are kind of selecting certain parts of the science and promoting it, and neglecting other parts of the science. And so for anybody, whether you're like therapist or any health professional, I think the common thing is to be read on the topic, and to research and find those articles that give you the most information. That'll make you the most relevant, because you'll be ahead of the curve.
Yeah. I think that's spot on. If we can't take anything else out of the discussion, I think everybody wins just from hearing that repeatedly and from somebody as established as yourself. So really appreciate that. Those are great points. Let's try and shift gears and move away from sort of where we are right now and some of the discussions that we've had. So just so everybody knows, Dr. Di Nardo is a father as well. He's a father of pretty amazing daughters, and 2 of them I had the distinct pleasure of working with on a daily basis after they had surgeries. Both of them soccer players and skiers, and they have a little bit of diversity in terms of what they do. But this is where we met, and at first a little bit intimidating to meet a physician and try to stumble a little bit, but then realize again, like, the knowledge is there. We spend hours and hours and days working with clinical patients and athletes, regardless of who their parents are or what doctor is looking at us or helping us or whatever. So after a day or 2, I'm sure, we jumped on board together. We started having a lot of discussions about how things were looking and some of the science behind ACL surgery in the pediatric population, and who the surgeon was, and just working back and forth as a parent to a minor, as well as a physician to an athletic therapist. So that was a huge bridge to build along the way, and that kind of brought us to where we are now. If you can step back just to it's kind of hard to take your parent and your physician hat off, but let's put your parent hat on and just walk us through your amateur sport experience with your kids. And recently, I guess, more than the whole history, but more recently, how was it as a parent?
Yeah, I wouldn't trade it for anything. I mean, I think it's for us, it's a privilege to be able to participate in a lot of those activities. And for any parent, child, or any child that can participate, I highly, highly, highly recommend it. I think it adds, it's about character building. And I think it's an area, an environment where you can flourish. And that ultimately, it's not just about attaining skill set of a particular sport, but rather going through the process. There are so many opportunities to kind of meet challenges, overcome challenges, and in that process, learn and develop a whole bunch of character traits that are not going to be just sport specific, but really life specific and aid you forever. So, so we, like James said, we have 3 children with three daughters, and essentially they played the same sports. They play soccer 8 months a year, and they downhill ski 4 months a year. And different sport sets and different sets of skills, team sport versus kind of a solo sport. And each has its own challenges, and both have been great opportunities. And again, I wouldn't trade those opportunities and those experiences for the world and for them. And they kind of express the same sentiment. So, for anybody, opportunity for, the kind of things as a parent going through it, it gives you opportunities to have discussions with your children on how to deal with certain issues. And I say, today it's your coach, tomorrow it's your boss, today it's your club, tomorrow it's your organization, right? So is anybody going to really care whether you can bend a corner kick ball by 3 feet and put it in the top corner when you're 45? Probably not. But the emotions you feel before the game, how you interact with your coach, how you feel nervous before a game, those are all, how you deal with those emotions are no different than when you go to your job interview or a performance review or any other thing, or you want to rally up the troops because you have a sales meeting. It's no different than a game, right? So those are like practices or dress rehearsals for those things later in life. So, or how do you plan? How do you plan to get better? Or how do you, challenge yourself to be more fit? These are all things that are lifelong skills. And so for me, those are not necessarily skills that you get in a regular school setting. And in the sport and amateur sport environment, I think it's an opportunity at whatever level, at a house league level, at an intermediate rep level, or a high level. There are opportunities there for everybody to learn. So that's from a parent, that's the value I have. It's not, but that's the value I think. That's why we enrolled our children in the sporting activities.
Right.
The only thing there is that at the end of that process, my feeling was that those skills and those experiences are not necessarily celebrated. You kind of end the process and then you kind of go on your own way, and no one really acknowledges the voyage you went through and the person you are at the end of it. And I don't think there's recognition for that.
Right. I mean, and you have a great schematic, and I'll share my screen here in a second with the schematic that Dr. Di Nardo came up with, and everybody can see that. We'll kind of walk through it because I think it's heavily important. We walked through it a few times, and it's I keep going back to it and seeing like, oh, there's an opportunity, there's an opportunity, there's an opportunity, and this is kind of why we're here. But at the same time, I think all of the things that you mentioned as a parent, we recognize as reasons that we stay involved in athletics. Those that are practicing on the sidelines or in a clinic with an athletic population, all of that value of sport. The idea here is not to say that everything is wrong in amateur sport. It's just to identify some areas where we could boost it up and we could really enhance some elements of it. So shift over to your physician hat, turn it around backwards or whatever you need to do to put that one on. Were there some areas you felt like, there are some definitive areas of improvement? I know like through your network and our network or my network, we sort of linked up through a common coach who sort of, oversaw your daughters in some element of where they were playing and linked us up. But any areas for you that jumped out as a physician where you think this could be done a little bit better or differently?
I think from, let's say, from the perspective of athletics, certainly, an overall strategy from higher up in the organization about conditioning and injury prevention, resting periods, things that are a little more scientific, because there's always kind of competing agendas, right? In sport, are process oriented or results oriented, and so a lot of the rewards come from results, and so we're a lot of times focused on results and not the process. And so, everybody has their good intentions, but ultimately, unless it comes from the top down, that there's certain criteria that have to be met or kind of essentially, there are sometimes agendas that overrun. So I think, at the end of the day, this is over just about trying to make things, not that we're necessarily saying they were done in a wrong manner. I mean, these were very good experiences, very good clubs, very good coaching. But ultimately, in general, if I had to see but this is kind of pervasive through all sport. Again, parents are also results oriented, right? We wanted to win the game, we want to win the league, we want to win the championship, but rather in that process, are we putting our children a little more in harm's way and paying long-term consequences for short-term gains? And that's where the philosophies have to come from higher up and get those oriented. I mean, sometimes the language a lot of discussions we have. Somebody who has that experience, like an athletic therapist, could come in and say, hey, we're going to design this program. This is the science behind it, and get the parents on board and say, hey, we're doing this because ABC. We know long-term the science tells us this. And I think there's huge value there to get people who with the knowledge base, because the average coach doesn't have the knowledge base. The average coach probably has knowledge base in terms of, tactics in a certain game or certain training techniques but they don't necessarily know the athletic part of it. And I think there's a huge knowledge gap there within lots of organizations about proper training, proper rest periods, the psychology, different age groups. So, there's lots of opportunity in that space.
Yeah. And even we talked about a little bit when we had the women's hockey coach on from York University last week. He touched on sort of like overhauling. You almost have to overhaul the whole culture and move away from like this winning and this drive to succeed and these externally validated components of sport, and make it about, these lifelong learning skills like you touched on. And from our angle, it's about empowering people with movement and understanding their body, and how implementing these things at a younger age in a well-taught, well-educated manner, we then can have longer-term athletes beyond the soccer pitch or beyond the rink and all those other intangibles. So without further ado, let me just pull up your schematic, and then if you just want to walk me through it, because I think it'll take over the screen. You can just sort of tell me where to point. I'll know what you're talking about for the most part, but if you tell me I'm in the wrong area, then we can go there. But let's jump into the schematic, because I feel like this is massive in amateur sport, but anybody who's worked in I worked in professional baseball, and it's kind of the same thing. It's like at the major league level, the athletic trainers and the strength coaches have basically one job to do, and that's to look after the athletes, But those are well-established players who know their routines, who do all these things day in, day out. They essentially know what they're doing. But then you flip it down to the minor league level and the lower levels, where you have kids coming out of high school, kids coming out of college, kids who don't know how to send letters in the mail, like these kinds of things where these are the building blocks, and the training staff and the strength coach is also the travel secretary doing laundry, doing all these other things, and the salaries are way less at the bottom and much higher at the top. And it seems like if we inverted that structure and really put that into practice the other way, and that's just because I was getting paid what I was getting paid in the minor leagues, but also just from a buy-in standpoint and the impact that you have, from every single person that we've had on so far, the impact is much greater in amateur sport than it is in professional sport. It's much greater in single A than it is in Major League Baseball, just because of who you're dealing with and how established those athletes are at that time. So anyway, great points. I just wanted to drop that in because it's relevant not only to amateur sport, but since we're talking amateur sport, I'm going to pull up your schematic here. I'll share it, and then I think we'll be good here. So yes, so this is it here. I think everybody can see that. Yeah, are we good? You guys can all see that? And just give me a little head nod. Doc, you can see it and everything?
Yeah, I can see it.
Yeah, so with this organization is just theoretical. It's not
right.
It's whatever. So anyway, nobody jump on board to who is that and what are they doing, but that's just theoretical. So let's go ahead. You lead the way, and I'll just point with the arrow.
Yeah. So this was my first project when I got my iPad, and I had I could actually draw with a little pen. This is what I did. I kind of represented my thoughts after like 6-7 years of basically being involved in a soccer with our daughters, 2 of the 3 at the time. And how do we kind of have an overall look at the experience, and how could it be integrated to be, how could raise the bar? I mean, overall, like, this was a club that was doing extremely well, relatively speaking. Produced some very good soccer players, elite players, semi-professional, professional players. And so, but what I could see was it's so is that ultimately, in order to succeed, you had to put them first, right? So the individual development of the individual was of the most importance. We were the first cohort. Our second daughter was the first cohort of a new organization that they had developed for soccer. And so they had developed kind of an elite soccer training program, designated a number of clubs within Ontario, and then had those clubs play each other, and then had a set protocol in terms of training times. They had to have athletic therapy. We had athletic therapists available at the field at the time, and we would play on Saturdays. One particular day where they would kind of review and see how the players were developing. And so that whole program is now several years that has been underway. And at the end of that process, I said, I felt though overall that the whole organization of this league was really to develop a small number of elite players, and that was the purpose. And so my message to them was that if that was the purpose and that was the focus, that it wasn't going to be a long-term goal here. It wasn't going to be viable in the long run, because I don't think they were going to get buy-in from everybody. And so if you're going to enroll your child into a program where they're really only interested in 1 or 2 or 3 out of the 500 that are going to make it to the professional league, you're going to lose the bottom end, and there goes your whole program. So I wanted to let them know that they could get buy-in, not necessarily to just develop a small proportion of the athletes, but rather to have every athlete come out of this process with a skill set and something that they will have lifelong, and that was worth buying into, because this is not an inexpensive program. So that was the backdrop to developing this. And so the first thing you see is the big arrow in the middle is the player, and as you develop, so a young child, which would be on the left there, from left to right would be the process. And early on, you'd be really skill focused on the sport in particular. And as you go through, you're less and less focused on skill, but rather you then increase the kind of life skill focus. And that could be, developing goals, self-analysis, go back in coaching, giving back, all these types of things that you will increase as you go through the process. And then at the end, you actually either you don't work and you don't want to play the sport, you go into the workforce, or you go into post-secondary school education, but ultimately you're going to go to the workforce. And that's why on the far right, you end up in the workforce, and that could also be just professional sport. So along this way, and I think the first thing we'll do is really, where does the athletic therapist fit in? And that really is in that kind of sports medicine, university kind of, right? So this is where you integrate an athletic therapist on multiple levels. So you could integrate the athletic therapist from a design perspective. So this is going to be our workout schedule. These are going to be our mandates. This is going to be our mandated rest period after you play 1 game or 2 games. And so you have a science behind the conditioning and training of the athlete. And then you can also have the athletic therapist run the program, run the training sessions. And then you can also have the athletic therapist on the field on the time of the game day to make sure they're there to, assess athletes at the time of injury. Are they appropriate to go back into the game? Are they not? And how do you triage them to the most appropriate medical assessment center, whether it be X-ray, ultrasound, whatever.
And if I could just jump in for a second, I think that's crucial at this level, but even if we go back a little bit and we're looking at the young child and we're talking coaching, people who have a little bit more of a niche working with younger people with that demographic from a background of AT can certainly jump in here as well. I'm not saying that you're omitting that, but here as well, and really formulate the foundation. Because what I tend to see, not everywhere, but is a general statement, and I'll pull up a couple slides that I added to this just earlier in terms of prep for this, but is the sports specialization and younger kids now, younger and younger and younger, seem to be being treated as as just little mini versions of the professional athlete. And that's just not okay. But also it's like nobody's out there pounding the drum on like, this needs to be flipped on its head and here's why, you know. And I think we have enough validation, we have enough science, and we have enough practice to see what it looks like at 19, 20, 21 if we keep doing the same things over and over again.
Yeah, absolutely. Yeah, so the top boxes are not necessarily in continue. They're actually kind of interact all the way along.
Yeah.
So from day one, and the coaching's from day one all the way through, and also the organizations are all the way through. So, but absolutely, and that's part of the whole thing about the athlete, right? So that specialization of doing the same sport 12 months a year, is that really beneficial? And so this is another area where you have competing agendas, right? You have now coaches who are hired by the club and they think, you know, you're a one sport athlete 12 months a year and that's all you do. But is that really beneficial? Is that really beneficial?
Right.
And we discussed that article that was published by the American Academy of Pediatrics, right? About the soaring number of injuries because of repetitive use. And ultimately, those athletes that are very successful are not playing a single sport, you know, at the collegiate level, right? So I think you're probably quoting from that article.
Yeah, exactly. So just to jump in, I'll just throw this up here, and I'll post this again afterwards with the video, but so with the articles and all that, with the proper referencing, the way that we're instructed to do. But so this is what's actually out there, and what's actually happening in sport is I think the motivation is good from coaches and programs, but when it comes down to it, if I'm paying money as a parent, I want to see my kid on the field those 19 hours that they're supposed to be on the field. So I think having somebody accessible that can explain the value of not being on the field for every one of those hours every single day really goes a long way. But let's jump back. Yeah, I think this is amazing. This is a great schematic to really show everything that sport can be in all the areas where I think AT and physicians and this working network can really be brought in. Yeah.
So, and that's exactly it. So, just that's what brought the highlight of, you know, the parent who wants to see their child on the field. I think, you know, on the left-hand side, this is where you have the discussion with the parent. This is why I think you'll have much more buy-in if you explain to the parents and say, listen, you're going to sign your child up to this club to play this sport, and we're going to play this sport. But at the end of this process, it's not about the sport. We're going to help your child develop skills that are not sport specific, but life skills, right? That, you know, through this process, when your child goes through their first it's not going to be a foreign for the interviewer to ask them about self-reflection. What was their best experience? What was their worst experience? This is something that could be dealt with in the context of the amateur athletic experience, right? And that's where I think the selling point is to the parents, because I think there will be no shortage of parents to sign up children to know that they're not here just to win a cup, but rather develop a skill set that they can use for the rest of their life. I think there's no shortage of parents that will be willing to throw money at that, right? There's so many, at least that's our experience, I'd say, in the, you know, greater metropolitan area of Toronto, where we've had experience. In more remote communities, maybe not the same experience, but I would say it probably would be. But that's the stuff that has to be told at the beginning, right? Because no one says that, and then all of a sudden everybody just wants to show up to the game and yell and scream to make sure you win 2-1, and that's what's important, and you feel you've accomplished something at the end of the game. But really, you know, that's the short-term goal, right? And it really is it a goal. And so it's really about the proper goal setting at the beginning and having the proper people give input into that plan. And that's where I think professionals, whether it be psychologists, athletic therapists, physiotherapists, whoever. And the bottom part is really the business private partnership, right? So from there, I'm thinking more HR, right? So you're going to be interviewed by some HR people in your first job. Why don't we get HR people to kind of give us input within the club to say, hey, these are the qualities and skills we're looking for, and how do you incorporate that into this whole process and implement those things? Because really, whether you're 11 members on a soccer team wanting to win, or play together, or you're 11 people in a sales force, and how do you divvy up your geographical area and distribute sales and come up with a common goal? What's the difference, right? So those are things that can be built into that amateur athletic experience. And the other issue there about the secondary school was more of the athletic part of it, where you can integrate some of your sporting activities through your secondary school. So some of the athletes who are doing very well or want to pursue this could really incorporate some of their secondary school experience, maybe a little bit earlier, participate in training, and incorporate that at that level, right?
Yeah.
The other thing I mentioned before in terms of the university in sports medicine is really taking it to the next level, and how do we make this also, a more academic, research-oriented environment, and those people that are interested in collecting data and giving feedback. And for instance, ACL tear. So the incidence of ACL tears in young women 6 times that of young males, roughly. Are we, collecting that? Are we collecting data on, if we're doing the FIFA 11 before, are we preventing those ACL tears? If we're implementing this regimen, what's the the effect? Scientifically, doing things that are going to be evidence-based. In order to do things that are evidence-based, you got to collect evidence in a proper way, in a proper format, in order then to analyze it. And so it's always, these are all feedback loops, right, to get better. So huge role for athletic therapists in that area, where they could take the ball and run with it, figuratively, where you could really promote that whole. And so if you're a parent looking at just soccer, I have a whole team, and my child is going to go through this process, and they're going to develop a whole bunch of parts of their character. At the end of this, it's worth it, and they're ready to face the world when they're 18, 19, 20, then hey, I think you're going to get a lot of buy-in.
Yeah. I think all of this, and this is, I can't remember if you said 30,000 feet or 300,000 feet, your view of things from that distance away, but this really lays out a lot of points. And for me, even looking at it and trying to follow your schematic is quite simple, because I know you and we've had a lot of dialogue, but even just to take the voice away and look at this model, there's a lot of penetrable points from an AT perspective. And so this is hugely valuable. And the research side of things in Canada, especially, I think there's a huge opportunity, right? As your daughters were coming through, they sort of sparked an interest in me, and I ended up doing my master's based on knee injuries in that varsity population and collecting data that was worthwhile, because all in all, there's not a ton out there in Canadian data. There's a ton out there from the NCAA and the college and the US and where FIFA and Europe and all these places, but there's not a ton in Canada. There's certainly not a ton in certain sports, at least. Hockey, definitely, there's a lot of research being done, but other sports in Canada are just as opportunistic in terms of providing some really relevant data. And the FIFA 11 Plus, it's already been established, but how many clubs are actually implementing it properly? We know that NMT, or neuromuscular training programs, have a direct effect on injury and non-injury and preparedness for sport and these kinds of things, but yet the implementation comes down to, we don't get that extra drill working on that, what do you call it, bending it from the corner, if we're doing the FIFA 11 Plus. But that FIFA 11 Plus, to me, I think can be talked into a lot of ears to be a whole lot more important than that extra 7 minutes of bending it like Beckham.
Right.
Yeah. I just flashed this other one up here. This is just from another article that we pulled up and we had chatted about in the past, and for the pediatrician. So when you're looking at pediatrics, things differ a little bit, but this is more along the lines of sports specialization. And the reality out there is that sports specialization is it's absurd. It doesn't make any sense. There's nothing out there in the literature that says, I'm going to specify early and I'm going to turn out better. The idea, logically, it makes sense, but the reality of that is just not proven, right? Is that a fair statement?
Absolutely. Yeah. I mean, especially at a young age, right? And this is again a knowledge gap with regards to parenting, and that and this is like the frog in the boiling water, right? So you don't necessarily mean, some parents think their kids are destined for glory and start off very early, and so that's a whole other set. But for most people can start their, and then you come in the next level, and you really get dragged into all of a sudden playing the same sport 5 nights a week and doing doing it, and the coach expects it. Yeah. And before you know it, what you thought you were never going to be doing, you have no choice but to do, right? So, that's just that. So that has to start from the club level, because from a parenting perspective, the coach says you got to play 5 nights a week. You have no choice, right? And you have to, when you're on the team, it's kind of hard to challenge that. So it has to be from higher up, from an organization, and that they have to buy into that. But I think if they do, it's an easy sell to the parents. It's an easy sell to the parents, and I think you'll have no shortage of people line up for the right reasons. Right?
Yeah, and
I was going to say.
Yeah, go ahead.
No, go ahead. Go ahead.
Yeah, no, I'm just trying to tie it back to, we had a coach on, again, this hockey coach at York University, and he's great with athletic therapy, and he really, the buy-in and the culture and the understanding what a team needs to boost morale and understanding the pulse of that team at that level. But a lot of people don't understand the pulse of 7, 8, 9-year-olds. And again, we're treating them like little mini Sidney Crosbys or little mini Haley Wickenheisers in hockey or whatever we're treating them as, instead of treating them like the physiological being and area or point in time that they're in, right? And you look at all the medical literature, right. The thing that jumps out to me is time off, right? Like taking time off is a valuable thing versus overtraining. Like it's a pretty straightforward thing, but that time off could certainly be built into, all right, if they're going to be on the ice 6 nights a week, maybe one of those sessions a week turns into on ice, but valued, or 20 minutes of every on ice session is valued athletic therapy driven type stuff, where it's injury prevention, deterrence, or even simply education. Like, here, know where your body is in space, know how to differentiate between right and left, or hip and low back, or these kinds of things.
Yeah, absolutely. I mean, just some stories I'll share. So in the ski world, we've skied, and our kids have skied since they were probably 1 or 2 years old, and competitively skiing. We've seen a number of athletes go through, and some of them are on the national level now. And going through some of the coaches, one of our coaches, his father was a U.S. ski coach, national ski coach, and when he was skiing, his father didn't let him race until he was about 14. Whereas, let's say in Niagara Escarpment, where we ski, there's a very high competition by the time you're 9, 10, 11, 12. And yet his father said, just go out and just free ski and just feel your balance on the skis and go off little cliffs and experiment. And yet when he went on the circuit, by the time he was 14 and 15, he was leaps and bounds ahead of his contemporaries. So that's number one. Number two, it does appear, though, that sports specialization is the almost way to go. If we see the ski community, it looks like by the time you're 16 or 17, and that may be right, because at that time you have to go to some specialized school like what we know as the Burke Academy or Green Mountain in the northeastern U.S., where a lot of the U.S. national skiers are coming out of. Okay. Where specialization is, if you really want to get to that level, higher up. But that doesn't mean you have to start at 9 or 8. Yeah. Or 7, or right, and so that balance and like that balance has to be there. That it isn't you're not going to the Olympics when you're 12, and if you think you are, most likely you're not, because you're going to burn out before you even get there. And that balance, right? That's what you're talking about. So that has to be incorporated. But I would have to say that it has to be done at the higher level from an organization, because from a parent level, very hard to combat that.
Yeah, without a doubt. And so just talking on how you would deliver maybe this without the backing of somebody like yourself, a physician, I think building relationships before you go to a parent group and do this on your own, because if you're not well read, or you're not supported, or evidence-based, I guess is the term, but evidence-informed at least, where you're not privy to these things, and you're not anticipating what the feedback is going to be, or the kickback is going to be, you'll end up walking yourself around in circles. So so I think just some of the literature, there's tons out there in the pediatric and amateur world It's not about going and pointing fingers and saying these are the things that we're doing wrong and we need to switch everything. It's about how can we augment. I sort of use an analogy in my own mind about supplementation, right? It's done wrong. A very large percentage of people who use supplements in the nutrition world, we take 170 grams of protein and 150 of that ends up going out the other end anyway. But because somebody on TV does it, I'm going to try it. And the same thing goes here, right? It's a matter of getting the information and having sort of maybe a network or a quality behind it before you go. But I think there's a lot of room here for athletic therapists, young, old, new, fresh, not so fresh, to come in and do this, right? And maybe build networks. And I think, like for yourself, although a family practitioner, you have a heavy interest. You're very well versed in terms of sport injury and the data and the literature that's out there. And there's plenty of people out there from your end, maybe from a medical standpoint or a doctor or physician standpoint, that would be on board with this too, right?
Absolutely. I think it's just the right thing to do. It's just, even just for injury prevention would be number one. But I think overall, it's just from a perspective of how you tackle it, right? So introducing the scientific method, introducing evidence-based approach to what you do is what, when I went to medical school, those were the key buzzwords, right? So no matter what we were going to recommend to our patients, we were going to use evidence to guide that. It's not because it's been used for 200 years, so we're just going to continue to use it. We're going to study it in double-blind control studies and say this is the evidence, and then we can convey that to the patient. Say, okay, I'm going to prescribe drug X, and we know that if we use it, you have a 25% reduction in mortality over a number of years, right? So that introducing that kind of philosophy into a club, I think, is beneficial. And so so what you recommend to the athletes within that club is something that is rooted in evidence and science-based kind of knowledge. So I think in order to sell it, I think it has to be to the level of promoting more enrollment in the club. It almost has the kind of sales pitch I would write to say, by offering these services, we are going to increase enrollment, because at the end of the day, a lot of these clubs now have full-time employees, right? So, so this is really their full-time. It's not just Bob the fireman who coaches something at an amateur level from 5 to 6 and turns back to as a fireman on his regular job. So a lot of these are now full-time jobs. And so they can become full-time enterprises because there's no shortage of money and parents who want to pay money to have their children participate in these programs. And so by enhancing the experience, I think you're going to get more enrollment, because what I saw in that soccer league that they developed, the enrollment started to drop off after year 2 or 3 because, it wasn't all that was kind of cracked out to be. That really the focus was really on maybe developing a small number of players for the National League. And ultimately, it was shown because by grade 11, they dropped off the league. So it wasn't a full experience. It almost dropped off as soon as they kind of picked their players. They then kind of tailed off the whole experience instead of kind of going through into collegiate sports. Right, so what they're saying, their actions were not congruent with what their philosophy was, and so that's where you can see right through it. And so this has to be a program that kind of is tailored to the individual and goes through the whole experience, and then basically when they go off to college, and of course then it's the next step. Right. So that's where I think in order to kind of, I think that's where the sales is, and that's where we have to let them know where the value is. And if they see the value and parents see the value, then the whole kind of business program will work. Business plan would work.
Yeah, and it also can work from an angle of differentiation, right? Because there's not a lot of clubs out there. There's a lot of clubs that have sort of fly-in therapists who come in and cover games. To me, that's not where our value lies. Our value doesn't lie in triage. It doesn't lie in being there on the sideline. It lies in all the other space where things actually happen. Like injuries might happen on the field, but all the other stuff in terms of injury deterrence, the psychological stuff, the referral for different things based on interaction with athletes on a regular basis. And that could be a differentiating factor for a club, right? Once you establish and you can find a coach or a series of coaches that say, hey, I agree, this is very much, and there are coaches out there that are like this. It's just a matter of finding them or convincing them that, hey, this is going to add value because X, Y, and Z. But Dan Church touched on it. I think we had a pro hockey guy on here, and he touched on it at various levels of his career where, there's buy-in when there's care. When people know that you care, there's a lot of buy-in. And so that could differentiate a club if you have something like this in place as well, right? Like to be the club that has this is gonna separate you from the bunch. And I think that time that you're talking about in terms of like 16, 17 and kids starting to fall out, I think I was right alongside your daughters when this was happening. And this is when the injuries started happening too, right? Where hormones change, the physical level and the requirement of on-field time ramped up right around the time when both your daughters got hurt. And there wasn't a lot of advice. And there wasn't a lot of people in place to help say like, oh, whoa, what are we doing here? Just because they're 15 and they're getting better than everybody else, they still need to be, sort of held in check. And this needs to be done with evidence, and that progress needs to be, it's not going to be linear. It's going to be non-linear, but how does this look overall? And having an overall schematic to things is where I think athletic therapy, strength and conditioning, physiotherapy, like it doesn't matter to me what the title is, but I think just people who are knowledgeable and passionate, and because we are athletic therapists predominantly in this chat, there's a huge space for that.
Totally agree with that. I think, the frontline work of the injury is just the beginning of it, right? The bigger role is higher up in planning and making decisions about overall athletic care and where things are going. Integral. And I think that the person you have to convince is probably like the technical directors of the clubs, right? They're the ones that kind of then disseminate the information to the other coaching staff. So you have to be kind of on par at that level to then the information. And maybe, and then there's a hierarchy of probably athletic therapists within the club. They're the front line kind of injury on-site assessments. And at the next level, you have the person who kind of supervises, and the next person who kind of organizes it. But and they're okay. Not every club can afford that many, but certainly that one person can wear a couple of different hats there. But certainly has to be much higher up in the club in terms of the philosophy of how the program is run.
Yeah. This was my schematic of how we're going to talk today or tonight or with amateur sport. If you can't see it, it's an iceberg, and this is the water level, and all of this that's not exposed is underwater, but up here is on field. So I think you're spot on. Your schematic is a lot prettier than mine. It has a lot more ins and outs. But I'm not a big scuba diver, but I'll put my scuba diver mask on and go under there and explore this if I'm really looking to get into amateur sport. And I think this is great. It's on the surface. It's also valuable for sure to have professionals who are acting like professionals on the sidelines and discussion with coaches and athletes and parents. That goes a long way. Don't get me wrong. I'm not knocking that, but the bottom of it, like we've talked about up until this point, it is massive and all based in some really good evidence for change as well, right? So,
yeah, and I think the other point is, right? It's that bond in terms of the professional relationship of the caregiver with the actual patient/client, and knowing that their needs are first and their needs are acknowledged, right? And that's invaluable, right? If you're gonna have that therapeutic bond, you have to have that. Otherwise, you're not gonna get buy-in.
Yeah, 100%. So these are all like, not even intentionally again, but like all of our speakers and the guests that I've had on to date, these same threads keep coming up. And so if this is doing the same thing for anybody else out there, my brain is just going like crazy right now about how we can tie all this in and make this better. And it comes down to stuff like this. It comes down to dialoguing and having access to people like yourself, Doc, and the coaches that we've had on. And this is where we're going. You know, you and I had a discussion about a top secret plan that we're going to work on and continue with this model. And by the way, we need to talk more on that because I have some other inroads with that.
More arrows.
Yeah. More arrows and the glasses of wine that happen off camera. But so this is great. I think there's a ton of value in this, and hearing it from a physician who has not only experience as a physician but as a parent as well. So maybe you want to talk just a little bit about the experience that you had in terms of your daughters and the injuries that they went through, and some of the things that were valued from an AT standpoint. And it doesn't matter that I was the one treating them. I think it would have been the same if anybody on the screen was treating them. But what were your interactions like from an athletic therapist? I'm sure you've dealt with chiropractors and other people along the way, but specific to athletic therapists.
Yeah. So first of all, I mean, I can't say enough good things about you, James. That was,
Talked
amazing.
about.
Thank you. So, it was, I would say first and foremost is that therapeutic relationship and the trust that was over the number of days from the very first time we met behind the stadium of the football field in the little locker room to first of all, not believing it was an actual ACL tear because clinically it didn't fit the whole picture, but ultimately the MRI demonstrated it, and there were subtle clinical findings. So, but ultimately it was, having the prehab, having the pre-surgical rehab and strengthening, going through the surgery, and then having a very detailed outline program for the rehab, and having certain targets, meeting those targets and moving along that continuum, and then at the very end of it being and through the process return to sport, and knowing the knowledge along with it and why we were doing certain exercises and the intensity of the therapy, right? And so that was an amazing experience. Now, obviously nobody wants to go through it, but having been put in that situation and knowing it, we can't thank you enough. And there's huge value there. And that is a reflection also of someone's passion and what they put into the rehab, and that therapeutic alliance you form with somebody who performs that for you. So, it's something you are thankful for the rest of your life. These are not small obstacles to get over. And for a child who, has a season-ending injury, a couple weeks before, expecting to be on a provincial team, that has a lot of challenges, a lot of emotional challenges, and a lot of challenges in terms of getting the rehab. And it's not easy to motivate somebody to do all the work it takes. It's not easy for somebody that age to go through that. And so, it's great work, and we're very thankful, especially to you, James, and to all ATs.
Yeah, no, I appreciate it. And
so
yeah. But your numbers are also quite easy to work. As athletes, they're dedicated as to be. For teenagers, it was amazing to experience. But
yeah, I mean, but it's a whole family endeavor, right? Because finding you was, thankfully our technical director directed you. We didn't know each other beforehand, so it was also trying to be informed and going out and getting the right information. Not everybody, let's say within the club, would pursue things like that, right? It wouldn't just come naturally. We've had several other families go through very similar injuries, and they're not going through a fraction of the rehab we went through, right? And so there's a huge variability there, and it doesn't matter whether it's a full-fledged quote unquote physiotherapist or athletic. It's really dependent on the passion you have for the rehab, the knowledge base you acquire through experience, and how you then interact and motivate your patient/client to participate and buy into that program. Those are all skills they don't teach you. You have to kind of develop them and have a passion for.
Yeah. So just to provide everybody with a little bit of background further to that is through the whole process. This is from like pre-surgical to post-surgical to return to sport, and then we stayed on actually together as friends now and colleagues, and then with your daughters, we stayed on and trained afterwards, right? To sort of sustain that momentum that we had created, and again, like coming back to your model, I look at that and see that there's very much life skills developed in that rehab setting for your daughters, both very different individuals. So and the rehab went the same way, one I could push and wouldn't say boo, and the other I would push and would question it, and I think that's awesome. And that's where the art of the rehab, the rehab as a general parameter has general parameters that are followed, but they get tweaked and moved and dependent on the surgeon as well. A lot of really good experiences in the pediatric population, working in sort of like the with the teenagers who are going through that. And again, it comes down to who you're working with as well. There has to be passion, there has to be buy-in on that end, and that's created both ways. It's hard to treat the people that don't want to be treated, but at the same time, that's part of our role. And the surgeons that you used, it was Dr. Murnahan, right? For both of them, was it both of them? Did he do both?
Two different surgeons.
Two different surgeons. That's right. Yeah.
Yeah,
okay.
That was,
yeah.
We had a couple different, it was really based on timing. We wanted to get the surgery done fairly, and so one surgeon was available the first time, and the second time he was on holidays, so we had another surgeon, both very competent. Yeah, so and we know that surgery isn't overly difficult. The difficult part of that is the rehab.
Yeah, and in that age as well, the difficulty in rehab in that age group is the re-tear rates are through the roof. And part of that is because of everything we've talked about to this point, is the overtraining and the under education and the lack of understanding what this is actually doing to people in the long term. But as part of this discussion with AT and the amateur sport, I think there's great opportunity for ATs to network with physicians in these scenarios as well. I certainly reached out to you as the parent, but also you connected me with the surgeons following, because we have our own protocols. Where I was working, we had a certain set of protocols, but that doesn't apply because it's not the same patient, but the general parameter did. And then it's tweaking it based on what the surgeon's protocols are and what the return to play procedures are and what tests need to be passed in terms of a pediatric patient versus an adult versus a hockey player versus a wrestler. All these things matter in the rehab. So I think understanding of the sport as well goes a long way in deliverables from an athletic therapy standpoint, and going to a sport and saying, like, I can offer you this, but based on literature and evidence-informed practice, as well as a knowledge of mechanics, biomechanics, the sport itself, all these things, and then driving this network of getting to talk to surgeons. It's like talking to a professional athlete. They're really good at one thing that we know about, and probably many other things, but they're also human beings. So having a talk with a surgeon about what did that tissue look like? What did it look like before? What does it look like now? And just understanding the anatomy and the actual surgical procedure goes a long way too.
Yeah, I would say, surgeons and the way in terms of how we are set up in our local environment, surgeons are going to be very interested in terms of their whole own microcosm. How did the surgery go? Are there any complications? Is there any loosening? But overly, they're not going to be focused on progress and rehab. They're going to be there's a bit of superficial aspect to that, because the metrics you provided, I think when we went back to follow-up, I think they're a little bit surprised in terms of the details of the kind of timelines, expectations, the metrics that we gave them, which we need to really be more specific on that. And I think that's where the orthopedic surgeon isn't going to ask specific range of motion, degrees, strengthening, what can you functionality, right? Demand it if they don't have it. Everything good, any pain, having any troubles, and we'll address it, but not necessarily I can say, well, we expect you to be at this level by this time, and right. So this is an issue, and probably return to sport is more time-based rather than function-based.
100%. Yeah.
Right.
Yeah.
Is that the correct answer? Right. The correct answer is not time-based; it's function-based.
Right. My ACL is better. I had ACL surgery, not me, but the hypothetical me had ACL surgery. It's been 6 months. I'm ready to go. And it's been like, okay, what have you done? Well, I played basketball. I rode a bike a little bit. Like, we hear this all the time, right? Like, every one of us is nodding our head in this room being like, oh yeah, there's that patient who didn't work with me. And now I have to give them clearance to return to collegiate sport, university sport, pro sport. They were off doing who knows what in the off season. Now they're coming back saying they've done all this stuff. There's a ton of metrics out there that are measurable for sport. So when you're dealing with a sporting population, and certainly in professional sports, the metrics change. They shift a little bit, right? And in Canada, it's a little bit different in the amateur level because, yeah, you're right. It's like, is the surgery successful or not? And that's it. It's outcome based, and that's really it from the surgeon standpoint, just because of the setup. But that same surgeon, if they're a team doctor for the Toronto Buffaloes or something, then they're going to have metrics with those athletes, right? So yeah.
But I would say not because they're measuring, is because they have a team of people doing the measurements,
right?
And they'll just overrun it, they'll oversee it, right? And so they'll have a number of metrics that they'll review, but they'll have somebody, provide those services. So, again, that should be a philosophy within an organization, that coaches know that in order to have a player back, they have to, follow protocol and be certified by somebody within the club and say, okay, it's not that, because just getting a doctor's certificate to say you can play doesn't really necessarily mean much. I myself, as a family physician, if, I will ask them because of my own experience, but generally speaking, if they go to a therapist and they may only go a month, but the therapist, okay, whatever, that they are okay, that they want to go back, who might say no? But I don't know if it's in their best interest. I'll counsel them, but ultimately, they're putting themselves at risk. Yeah,
and concussion, obviously, a massive one too, where I think the level of knowledge, the depth of understanding is really coming around, and athletic therapists spend a lot of time with that. And I know there's a bunch of people on here that work specifically with concussion in concussion clinics and things like that, and that's the exact same thing. So regardless of the injury, it's the amount of knowledge and the application to return to learn or return to sport, and really understanding the ins and outs of what that means. Because ultimately, if you're symptom free and Dr. Di Nardo signs a paper that says, yep, you can go back to school, you're not there to hold their hand and walk them through that. And that's kind of where we come in, and we can be sort of an integrated model with the physician working alongside you in terms of what that means, right? So I think those are massive when it comes to sport injury, and then like even return to the classroom in this demographic where concussions happen all the time, as well as sport injuries.
Yeah, and just as a general summary, it's just bringing knowledge to the area, right? Just bringing expertise and bringing scientific sound knowledge to an area where individuals will need that guidance that don't necessarily have the knowledge. The coach doesn't necessarily have the knowledge. The president of a club doesn't have that knowledge, and so it's left to people to kind of make up some kind of judgment call without the right tools. So there's a big gap there, a big void that could be filled.
Yeah, awesome. I'll open this up. If anybody has anything specific with regards to these topics, feel free to either just pop your mic off and ask, or just fire it into the chat box, and I'll be happy to filter it over to Dr. Di Nardo. This nonstop thing, so I mentioned it to you, this Zoom platform usually gave us like 40 minutes, and I would say, okay, you need to buy this thing, and you're going to get timed out. You're going to either sign back in or this thing's over. We've signed back in multiple times, but now we don't have to. And look at that. We're already at an hour and 20 minutes. Time just seems to fly when we get going on some topics. So appreciate your time. Do you have a little bit more? If there are some questions, you have a little bit more.
Yeah, absolutely.
Yeah. Okay. Awesome. And then the other thing that maybe we can, right here. Do you have any experience with supplements and healing in terms of concussion? This was a question that was asked last time. We started talking about concussion. Do you have any resources on that, or an opinion or a medically backed, your experience with that? Supplementation in terms of recovery with concussion.
Yeah, I'm not an expert in that area whatsoever. All I know is that we have a neurosurgeon in locally that basically uses omega-3. So that's the only kind of supplement that I would recommend. And the basis is, of course, the majority part of the brain is fatty tissue, and that's basically the myelin sheaths around the neurons. And there is some information coming out of the U.S. military and major brain injuries that we're using high-dose omega-3s for recovery. Essentially, there isn't a lot of harm in using them, and so I know the neurosurgeon locally is using that for rehab and for post-concussion kind of syndrome. So that's what I recommend. The exact dose, that's to the.
Yeah. Okay. You kind of cut out at the end, but that's great.
I think I lost you there, James.
Yeah, no problem. You cut out a little bit at the end, but I think you're not an expert in terms of dosage and all these kinds of things, but definitely like something to look into, at least a starting point. I hope that helps, Marietta. And then another question that just came in, we'll sort of just bounce around as they roll in here. Do you have any suggestions, Doc, in terms of ATs in order to network and connect effectively with physicians? So to sort of initiate that dialogue. In the U.S., it's a lot easier because athletic trainers in the U.S. who have a similar backing, a little bit more of the pharmacological side of things, but are almost like physician's assistants, where it's a medically recognized profession in the U.S. Here, maybe not so much, but anything you might have to help network with physicians?
Also, I guess you'd have to kind of put in what context. Or context in terms of, are you working within a facility that offers rehab services, or are you more as a consultant or as a personal kind of trainer? Like, it depends. I would just say connect and send some sort of information to the physician in terms of what services you offer. And then you got to match with the physician that kind of, you have patients in common. So obviously, if it's a sports medicine physician, it's one thing. If it's, for me as an occupational health physician, there may be some value there in terms of OC Health and organizations that want consultants with particular issues. Like I have companies that have a lot of physical labor, and they may want to have some consultation in terms of working positions and sort of exercise programs and back injury prevention program. There might be that in place. Or you could have, like, I have a whole part of my practice is almost like an executive health practice where people want one-on-one consultations, and it all depends what kind of services you're offering. If you're offering like in-home services or personal rehab services, it's more or less extending and letting the physician know what services you offer, and then kind of targeting which physicians you should see and see if there's some common ground.
Yeah, and Stephen, I think it's a great question, and I think from our end, this also helps our profession, right? Like the more physicians that we reach out to and say, these are the skill sets that I host or that I value, that I utilize on a regular basis. Do you have any room for discussion? Do you have any room in your practice for this? Would you accept referrals from me? And then building that up as you go, building up the rapport and building up the relationship. Like the number of times that we have spent just going over, working diagnosis in a clinic from a sports injury standpoint. And Britt can probably speak to this as well, who's on the call, and just because I'm familiar with her and we've worked in the same setting. Like at York, I think 90-something% of the time we're evaluating things in a working diagnosis, and then they get to the sport med doc and we're spot on, So we spend a lot of time in the MSK realm. We spend a lot of time in the orthopedic realm. We spend a lot of time doing these specialized tests that I don't think a lot of people are aware of. We have a ton of really specified experience and knowledge in these areas. And I think maybe it's not quite as recognized by some physicians, but I think it's, again, let's utilize this like we're doing right now as an opportunity to really drive that forward as a profession on the whole, right? Have these discussions. You're a what? An athletic what? Don't you just go in the gym and train people? Well, no, absolutely not. I do, but that's like this much of what I do. Here's what we do. Here's what we can do. And if nothing else, you're informing them of somebody who's available out there in the world too, for in our world, in Ontario and across Canada. And I think that's part of this battle too, right? We have some downtime now. Let's start reaching out and really promoting what we do and some of the background that we have. Good stuff. And I'm sorry to go off on a tangent, but again, this is part of it for me is really, Doc, and I mentioned this to you on our call, but part of this for me is really gaining a little bit more notoriety within our profession, right? And we're connecting with one another on a regular basis. A lot of people here are returning guests, but you and I, Doc, are going to make this thing grow a little bit, I think, together, if and when a return to the homeland happens. But I think as we go, we just continue to have this dialogue and we build this outward, right? Like we build this network and we build out relationships and understanding as to what it is that we do. So Stephen, thanks a lot, man. That's a great inroads to some really good dialogue for everybody on here. And I don't think it has to be much more difficult than reaching out and just saying, like, I sent Dr. Di Nardo and I sent every one of our guests like the little blurb from the athletic therapy website. What is athletic therapy? And I just put it in there so that, like, just if you're not overly familiar with what we do, here's what we can do, and maybe just as a link or something like that, and then a resume and all the experience you've had. Another question came in that was posted. Aaron, thanks. First impressions that you feel mean the most as either a parent or a doctor, or a parent doctor or a doctor parent, with ATs being introduced to youth sports settings. So somebody on the sideline, like, what goes a long way from I don't know if it's a perceptual thing or whatever, but as a parent, if you see somebody on the sideline, what resonates with you in a positive manner?
I think a sense of professionalism, that you bring. In my experience, you can see in terms of injuries, if it's at the site of the sport. If you're assessing an injury, you can kind of guess pretty quickly or assess pretty quickly someone's professionalism, how they interact with the athlete. That goes a long way. How you introduce yourself. Those are first impressions, right? And contextualizing what you're doing, the counseling that goes around it. How these are usually how you interact with the individual athlete, whether it's a 7-year-old, a 10-year-old, a 50-year-old. They have different expectations, and how you deal with that injury and kind of assess also the emotional state of the person. Those all kind of come through from someone that's observing from 6 to 10 feet. And so that's important, right? So, don't think that those things are not observed. Those are all very important things.
Yeah. And so some of those are not some of those. Some of the situations that we're put in as ATs when we're just trying to either make a living or taking on 6 or 7 different parts to make a full-time gig, it's really difficult to drop in on a Saturday afternoon and be an athletic therapist for a team that you know nothing about. So my recommendation in those scenarios where it's not a regular team and you're not with them on a day-to-day basis is ask for 5 minutes at the front. And here's another opportunity, just as Stephen's question, to say, I'm an athletic therapist. These are the skills that I have. I'm here to do X, Y, and Z. If you have any questions, I can deliver on these. And just asking the coach for a little bit of time as soon as you get there to speak with them. It's hard to drop in and just, be the AED supplier at the men's hockey game, and sit in a room until you're called and then jump out there and expect to deliver on something. So if and when you're given the opportunity to be on a sideline, get there early, be professional, talk to the people who hired you if they're there, definitely align with the coach. And guess what? After the game, go spend 5 minutes with the parents if the team won. and just chat with them and just say, like, here's, I was on the sideline tonight, and this is my role. Here's a little blurb about what athletic therapy is. Again, like, I'm just spitballing things. These aren't things that I'm doing currently, but as I'm away from it and hoping to get back to sooner or later, like, these are things that I see as valuable. This is just my own bias, but as valuable to drive the profession. The more people know of what we do and who we are and how professional we are as a whole, the better off we're going to be. And that goes a lot further than some of putting a poster up somewhere and hoping somebody reads it.
Yeah, you bring up a great point. And if you're just hired to, be providing services at the end of the line, then take that as an opportunity to say, I'm here to either, supply the AD machine, or I'm here to watch reads and services for these. You said I can do that, but I have other services more on the preventive side. So if it's about heart disease, we can talk about X, Y, Z about prevention. Or if it's about injuries, I'm here to help for injuries, but I also provide services about preventing injuries. And if you're interested, it opens the door for a discussion. You certainly can promote it in that way.
Yeah, awesome stuff. Anything from anybody else? We're approaching an hour and a half, which is pretty great for staying on, for everybody who's here and didn't have a coffee in their hand at the start of this. So the other thing is, like, the trainers courses that parents are doing. Like, these are great, that the fact that they've built these in now where parents can do a trainer's course and then they're the team trainer for the season. It gives a basic understanding, but again, like, ideally we replace those team trainers with people in the room, who can show up and say, I've done more than a weekend course. If and when you need to see me beyond the broken arm that you took from taking a slash in your men's league hockey game, I can provide that. Or if your kids play sports, I can certainly provide some other angles on those kinds of things. So I don't know. I think there's lots of opportunity here. So that's another good question. You come up with some brilliant ones, Steve. Thank you, man. So Doc, now as someone who's experienced athletic therapy as a parent and the great experience you had, as a physician, are you more likely to refer a patient to another athletic therapist? And then what would you say sets us apart from other healthcare professionals in your experience? I don't know if that one's directed to me or to you, but you can field that part of that or all of that if you so choose.
Yeah, for sure. And that is absolutely. And I refer, we have a number of clinics locally, but if it's a specific sports injury and somebody's got to take it to the next level, then it's directed to different therapists. But for sure, integral part in rehab, no doubt, in my practice. So, and it's all about that therapeutic alliance, right? So you got to pick a professional you're comfortable with, that is going to take it seriously and follow through, but it's also the right patient. So if the patient's going to be very superficial about it, you let them know. So it goes both ways, but for sure, it's been an integral part of my practice for many, many years. And we have local athletic therapists that work within a physiotherapy clinic or within other organizations, but certainly part of my regular day-to-day kind of referral pattern.
Yeah, awesome. And I think this is the question we get all the time is what separates you from, that other profession or those other professions. And it's not an easy one to answer, but field it genuinely and just look at yourself and look at all the things that we've done as students, as well as, budding practitioners or practitioners with some time spent in the field. And the whole gamut is here. Like, we don't just take from injury to return to sport. It's pre-injury, preventative, all the way through. And I can understand how to refer, when to refer on a lot of different things other than just MSK injuries, right? And not every profession has that. So how do we differentiate? How do we stand out? We keep doing things as professionally as possible. We keep networking, keep making people aware, and honestly just driving it home that any setting is an athletic therapy setting, right? So I just go back to Doc's introduction tonight about what he does and who he works with, and like fire, police, like active populations, amateur sport, like there's opportunity here to really dive into some things and deliver. So That's where we can differentiate. What is a physio? Well, you have coverage. Great, you have coverage. But how many people right now in this world are working with strength and conditioning coaches who are not on any insurance plans? A very large percentage of active people are either working with personal trainers, whether or not they're free right now online, irrelevant, personal trainers, strength coaches, performance coaches, et cetera, life coaches that aren't covered by insurance plans. It's about the deliverables, and it's about how you can maintain relationships and really navigate that, right? I know it's hard. It's hard to make a living and do this as a profession when there's not a job, but at the same time, it comes with time and this sort of self-promotion, I guess, to a certain degree as a profession. And discussions like this with a bona fide doctor who recognizes the profession, I think goes a little bit of goes a long way as well. Yeah.
I would just add, James.
Yeah.
I would just add, I think you gotta follow your passion, right? So the passion is what comes through, right? You gotta find an area, because it's pretty broad here, athletic therapy, right? You gotta find an area where you're passionate about it, and you gotta do your research and learn, and you become an expert. And when you become an expert, it'll shine, it'll show through. So, or you become a generalist, but maybe something that fits. Ultimately, it's the passion that has through. It's the passion that's going to drive you to do the other research and understand, a lot more of the area than the next guy, and that's what's going to get you the break. Yeah, awesome. I think that goes a long way. I saw a lot of nodding heads, not because they're tired, but I think there's a lot of agreement there, and I don't think this is a field that's generally filled with people who aren't passionate, right? You gotta have passion to stay in this and to have some longevity here and to be able to respond to everything that we respond to and be alongside athletes or active people or people that are trying to get active. So great stuff all around. I'll open it up for like one last question, and then I'm going to let Dr. Di Nardo get out of here, because I know he's probably got a full day tomorrow or something like that anyway. So anybody else? Yeah. Anybody else? Okay. Yeah. No. Yeah. Okay, great. So let's wrap it up with that. Anybody who wants to drive this thing forward from an amateur level and wants to reach out, feel free to reach out to me. We have some pseudo plans in place for some things in the future that we're looking into. Dr. Di Nardo, myself, a couple of the guests in future and past as well from this show. And so yeah, if amateur sport is your area and you want to dive in, let's have some more discussion on this, and we'll certainly come back around to it. And Dr. Di Nardo, if you'd be a guest again, we'd love to have you. This has been amazing. For sure.
Okay.
Thank you for inviting me. It's been my first long Zoom meeting.
Well, happy to have you. This has been it's been great. Sincerely, we really appreciate having you. I'll speak for everybody in saying that. It's been great. I think really, really informative. And obviously, like, your passion shines through. Your accessibility is amazing. And again, for taking the time out on a Sunday night, thank you very much for being here. Really appreciate that. Everybody else for being here as attendees and guests. Thank you guys so much. You make a difference for me. You make a difference for everybody here. And I think we just keep driving this thing and let's see where it goes. I think it's on its way to big things. Like I said at the top of the chat, please go and visit the YouTube site and subscribe, because the more numbers we have there, that goes well for everybody too. And I'll post the resources in the discussion or comments area, some of the articles where I pulled some stuff from, some of the points that Doc pulled out as well. So Doc, thank you so much. This has been Let's Chat, an Athletic Therapy Roundtable. We really appreciate your time. Thank you. And we look forward to staying in touch, and feel free to come back as an attendee anytime too. I think we might have lost him, but he's still there. There he is.
No.
Thanks again for being here. Thanks for listening. Thanks for being a part of this community. check us out online, firststartherapy.com. That's FIRSTAR therapy.com. Or email us with feedback, consult@firststartherapy.com, CONSULT@firststartherapy.com, on Instagram @firststar.therapy, and our podcast host @letschat.at. This is First Star Let's Chat, an athletic therapy podcast.